having a brother who's a school administrator in a large school district here in New York. He and I speak a lot about this. And I think we know of all of the benefits of having schools open for the children, particularly, and because we've witnessed a lot of negative impact that having been going to school remotely has happened over the last year and a half. So I think it is a good idea to try to keep schools open as best we can. And I think the best way to do this is to use proper masking, mandating, to vaccinate and mandate vaccines for all providers, including the teachers and the administrators, as well as the students who are eligible for vaccines should be vaccinated. And then a really broad testing to see and ensure we know who is potentially infected and therefore who needs to be isolated, and therefore everyone else can be safely in school. Right now, what we're seeing with Omicron is, and the data is really showing not only from locally, but also internationally, that it doesn't seem to be a more severe illness, particularly for kids. However, we're seeing many, many, many more children infected at this point and being admitted to hospitals. I know in New York, including our hospital, we're seeing probably 4 to 5 times the number of admissions for children with COVID over even just the last 2 weeks. And even in my ICU, I'm probably seeing 4 to 5 times the number of children who are currently in my ICU than we've seen. We're seeing record numbers of admissions of all children of all ages, from newborns all the way through 21 years of age in hospitals and in ICUs with Omicron. Not to say that it's more severe, but it's my experience so far is that it's not less severe, at least in kids. It's just that it's much more contagious, and therefore there's so many more people, and particularly vulnerable people like children who are not vaccinated yet, and therefore we're seeing an enormous number of admissions through children's hospitals. Well, I think we're still seeing a very wide range of symptoms that children are presenting with. We have a number of kids who are testing positive for COVID, but they come in for other non-infection related symptoms or for treatments such as elective surgeries, or if they come in with a trauma or other clear non-infectious sources of requiring admission. But we are seeing a number of kids who are also coming in with the classic respiratory failure symptoms, where they need oxygen or they need breathing machines like ventilators, and requiring many whom require ICU care. So we're seeing very similar to what we've seen all throughout the pandemic. We're just seeing much more of it right now. The children who are under 5 are not eligible yet for vaccines, and so they are the most vulnerable part of our population. And the only thing that we can do to protect them is to vaccinate. Everyone who's eligible to be vaccinated should be vaccinated at this point. And of course, really widespread testing is going to allow us to understand who may be infectious and therefore should be isolated from those who are vulnerable. So yes, the under 5-year-old group is definitely the most vulnerable group, and we're seeing a lot of children being admitted to children's hospitals, both here in New York as well as other states. And we as a society owe it to them to protect them by being vaccinated and undergo broad testing.
Schools need to be open. Everyone talks about the needs of our kids, their health needs, physical health, mental health, nutrition needs, their social development needs, their academic needs. Schools need to be open. And so we are moving every day to make sure our schools remain safe. We have been working very closely with the mayor-elect and his team to make sure everything is in place for January 3rd.
It is so important that we get our kids back to school as soon as this winter break is over. We all have such a strong public interest. We saw the failed experiment despite the very best efforts of incredibly hardworking, passionate teachers who did their very best with remote teaching, and the parents who were just pulling their hair out at kitchen tables trying to make sure that it worked successfully. Everybody did their part. But we also understand, as you mentioned, schools are safe. As a result of our joint mandates, and I have a statewide mask mandate for children in school to make sure they're safe. our teachers are vaccinated. So we all have to do our part to continue, though, to make sure that parents feel comfortable when they send their children back to school on January 3rd. So from our standpoint, what the state of New York can do to help best is to make sure that there are sufficient testing kits available to be used by the school district. And that is why I've directed our Department of Homeland Security and Emergency Services to provide 2 million tests to New York City to allow children to stay in school.